We need to stay vigilant to reduce transmission and continue to get vaccinated.
A Lyons boy almost lost his life to a serious complication of COVID, and doctors say there's an alarming uptick in what was once a rare inflammatory reaction to the virus. 13 ABC's Melissa Veitch joins us live with more on what parents need to look for. Melissa.
Well, Diane, the very frustrating part about this inflammation and that comes as a result of having COVID is that so often our kids are asymptomatic. They don't have any symptoms, and parents often don't even know that their kids were infected. Yet this very serious inflammation response comes weeks after they are infected. This is 7-year-old Easton Westbrook, a feisty, energetic 7-year-old from Lyons, Ohio. But in late January, a trip to the emergency room for a fever ended up in the pediatric ICU at ProMedica Toledo Children's Hospital.
They were saying that his lungs were not working correctly. His heart was only half working. He was struggling to breathe at this point. His heart rate, blood pressure was out of control.
Easton was diagnosed with MIS-C, or what's called multi-system inflammatory syndrome, and was put on life support for a failing heart.
It was very, very scary. He went down very, very fast.
ProMedica pediatric intensivist Dr. Sharon Thomas says this can happen within 4 weeks of a child being diagnosed with COVID.
This happens after a child has had the initial COVID-19 infection. They have gone through the infection, they've recovered from it, their body has created antibodies to COVID-19.
Symptoms include a rash, fever above 100.4, nausea, vomiting, and abdominal pain, difficulty eating and drinking, chest pain, and difficulty breathing.
Most of the children that we have admitted to the hospital with MIS-C, M-I-S-C, actually didn't know that they had an initial COVID-19 infection. They were asymptomatic, or their symptoms were so mild that nobody noticed that the child was infected at the time.
Thomas says it can cause inflammation throughout the entire body, including the gastrointestinal system, heart, kidney, lungs, and brain, and there's no way to know which kids will get it.
By and large, these have been healthy children who don't have any underlying medical problems.
For Easton, the news is good. He's now home, improving by the day after 10 days in the hospital.
He's almost back to normal. He's a little bit slower than what he was. His attitude is definitely back. Definitely back.
So the good news is that by and large, if kids get into the hospital and get treatment, they don't all end up in the ICU, by the way. Some are just hospitalized. But if they get treatment, they generally respond within 2 to 3 days, and they are able to recover like Easton. Back to you in the studio.
All right, Melissa, thanks. In Michigan, Governor Gretchen Whitmer and health leaders today announced that the state is trending down